I was privileged to meet at least 4 new people with new diagnosis of hyperthyroidism today, and all 4 of these patients in fact had Graves' disease. I promised to post this video so that if I wasn't clear in the consultation, you could listen to it again and base decisions and so forth on this. So first, what is Graves' disease? Doesn't mean you're going to go to the grave, especially if we treat it well up front. Graves was just the guy who described the disease initially. Second, it's not a thyroid cancer at all. So do not fear, you do not have a thyroid cancer. It is the functional component or the hormonal effects of this disease that the harm lies in. So what are the harms? Well, your thyroid impacts on every single organ and cell in the body. So the immediate short-term adverse effects are things like cardiac arrhythmias, things like coma, and things like increased blood clotting, with additional long-term effects such as bone loss if thyroid disease isn't treated up front adequately. So when we treat, what do we mean by treating? So we've got 3 options. The first option is surgery that we seldomly use today and reserve mostly for people with significantly large thyroids or very large goiters that causes a cosmetic problem or that interferes with functional problems such as decreased swallowing capacity and so forth. It's just the risk-benefit ratio is mostly in favor of medical or other treatment unless there are significant concerns due to size. The other 2 treatment modalities is radioactive iodine and carbimazole. With radioactive iodine, we label iodine, which is the predominant substrate of the thyroid that the thyroid uses to produce thyroid hormone, with a radioactive molecule that radiates in a very low range, so roughly 2 to 3 millimeters, and is concentrated in the organs with the highest highest iodine concentration, such as the thyroid. So radioactive iodine, if effective, will cause hypothyroidism on the long run because in fact it takes out thyroid eventually without surgery. The volume reduction, so if you've got a large gland and you're concerned about the size, as I've mentioned, you usually do surgery for these cases. But if the gland is just a bit of a cosmetic concern, you can expect up to a 60% reduction in size on the long run after radioactive iodine. Carbimazole or numercazole is a tablet that interferes with the production of thyroid hormone and thereby sort of overrides this TSH receptor antibody's effect on the thyroid. It's also been said that the carbimazole have a little anti-inflammatory activity in the thyroid, but this has not been inconclusively proven, and its main effect is the decrease in thyroid hormone production. There's another molecule that we do not have in South Africa, and that's PTU. I can't speak on that because I do not have any experience on that, mostly using the carbimazole in South Africa because PTU is not available. Radioactive iodine is contraindicated in people who are pregnant, and I'll do a separate post on thyroid disease in pregnancy. And always when we think about carbimazole, we limit the drugs that we use in pregnancy because of various consequences, and therefore I will do a separate post on thyroid disease and pregnancy.